I'm Joe. I'm the respiratory therapist here at Kaiser. What I want to talk to you today about is pulmonary hygiene with the patient. Whether their stay is just for 24 hours through the outpatient surgery or an extended stay here at our facility, what's really important is that we promote good, healthy lungs. To accomplish that, what we want to do is make sure that they keep their lungs properly inflated through deep breathing exercises and also promoting airway clearance with maybe encouraging patients to cough. When patients have extended stays in a flat or immobilized because of whether it's sedation or pain or the procedure that they may have, what happens is we inadvertently get gravity that kind of affects their lung expansion. And what we have is microatelectasis or atelectasis from which parts of your lungs collapse, and unfortunately it traps secretions. So the key thing to help with this is, one, either getting them up out of bed, keeping their head up, or by using a device like this, which is called PEP. In the packet that you'll grab from the closet or from the bin, there are other items in the packet. What you'll do is extra adapter that the respiratory therapist will use for breathing treatments. If you find this adapter in here, you can just discard it. You don't need to save it. But in here is also a patient equipment bag in which they can store their PEP therapy. The way this works is you're going to have the patient breathe in and out through this device here. And during the expiratory phase, they're going to breathe against resistance. What we have in here is a restrictor valve that's in here. And what determines the restriction are these numbers right here. And you can see 1, 2, 3, 4, 5, 6. 1 being the most resistance and less being the less resistance. To determine where your resistance is set, to the right here you'll see an arrow, and that represents where your setting is. As a rule of thumb, it's probably a good idea to start most of your patients on a resistance of 3, in the middle. The way this works is you'll have the patient put their mouth and teeth over the mouthpiece, have them breathe in normally, and then have them exhale through this resistance, and they'll extend their expiratory phase. What we're looking at is an IE ratio of 1 to 3. So when they breathe out, it's a good idea to help count for them. 1, 2, 3. That way you can get an IE ratio of 1 to 6. To make this effective, we want to generate pressures of 10 to 20 centimeters water pressure. And that's why we have this here. This is our pressure gauge. In here, there's a blue float that will float up during the expiratory phase. And our goal is to get it between the two arrows, which represents 10 and 20 centimeters of water pressure. Have the patient do this 8 to 10 breaths and rest. And then promote and ask them to cough 1 or 2 times after the therapy. We encourage you to work with your patients to do this, or encourage them to do this. So Betty, I'm going to show you how to use PEP therapy. What we have here is a device that has a mouthpiece, which you put in your mouth, and you'll breathe in and out through here. I have a restrictor device here, which restricts your expiratory phase, which will generate the positive expiratory pressure. On the restrictor device, we have a series of numbers, 1 through 6. 1 being creating the most resistance in which you'll breathe against, and 6 the least amount. To know where your restrictor is set at, over here to the right is an arrow which will point to what value you're at. I would recommend starting the restrictor valve at 3 and then make the adjustments based on the difficulty or ease of you being able to use this. To know that the other part that's really important when you exhale is that we want to make sure that you're generating pressures between 10 to 20 centimeters of water pressure. So we have this device here which measures that pressure. Between the two arrows there's a blue device here that's going to float up when you exhale. And what we want to do is get that to float in between the two arrows here, which represents 10 and 20 centimeters of water pressure with each breath. So what I'm going to have you do is have you sit up upright like the way you are. You'll put this mouthpiece in your mouth. You'll draw in a normal breath, and then I want you to exhale for 3 seconds. Okay, so count to yourself: 1, 2, 3, and then you can rest. And again, when you exhale, the goal is to have the float here rest between the two arrows. Let's give it a try. And blow out. 1, 2,
So I cough
3.
after each breath, or I cough when I'm done with all my breaths?
When you're done with all your breaths. After 8 to 10